credit for this class?
Only if you behave. Never assumed. Well, good afternoon. The governor will not be here today, so I'll be doing this one solo. First, let's talk about the numbers today, May 18th. In terms of the number of COVID-19 patients, we have people in the state of Kansas, 8,340 positive cases, which is an increase in 454 cases since Friday. We have 173 deaths, which is an increase in only one since Friday, which is a positive trend, as you will note. 58,650 negative tests. I want to compare these numbers for Kansas: 8,340 positive cases, 173 deaths. I was looking at two of our states to the north and northeast. Iowa, which is a state of approximately the same population, has 14,651 cases compared to our 8,340. They have 351 deaths compared to our 173 deaths. That's a remarkable difference between the two states of equal size. Of note is that Iowa did not and has not yet done any kind of stay-at-home orders by comparison to Kansas. Similar discussion with Nebraska, to our immediate north, obviously. That state only has about 2/3 the amount of population that Kansas does. And yet, Nebraska has so far 10,348 cases compared to our 8,340, and 123 deaths compared to our 173, which, when you normalize that for the population size, it's a dramatically higher number as well for Nebraska. And again, they're another one of the states that did not issue a stay-at-home order of any kind for its populace. Cluster information. We've had 95 clusters so far in Kansas. 47 are now inactive and 48 are active, accounting for 4,013 positive cases and 129 deaths. Corrections, 3 clusters, 920 cases and 5 deaths. Gatherings of various sorts, 10 clusters, 8 of which are inactive, with 123 cases and 11 deaths. Group living arrangements, there are 6 outbreaks, 5 of which are now inactive with 55 cases, 2 deaths. Healthcare settings, 3 clusters, all 3 are now inactive with 22 cases, no deaths. Long-term care facility, 25 clusters. Tracing and monitoring of clusters is critical to contain the spread of the virus in our state. Each of these is, as you have noticed, is tied to a certain location, but we remember that for the most part, with the exception of the offenders in correctional facilities, people live in the community as well. So it's particularly important to find them at their source. Roughly half of the positive cases in our states have resulted from the clusters that I talked about above. And these police department recruit academy. The gathering violated the stay-at-home order and serves as a reminder as to why the order was put in place in the first place. We encourage anyone who has symptoms after going to this particular public area at Lake Perry between May 2nd and May 10th to reach out to their healthcare provider. It's still well within the incubation period for the virus, I might add. Numbers, a science lesson. A brief one. And why are we concerned about the numbers related to the symptom onset and not the raw daily numbers every day? You'll note that even though I do report the numbers every day, it's not very helpful in establishing a trend line. And the reason is because it is highly dependent on when local health departments and laboratories report it to us, and they can batch those and have big spikes in one day. But what is very helpful is to track it back to the onset of symptoms, because that's what tells us on any particular day how much activity is going on that particular day. That allows us to establish a trend line. As we work to reopen, it's important to remember that the virus is still out there. This last weekend from the Lake Perry outbreak, and I'm sure there'll be more cases emanate from that. And by the way, there was many counties and even other states were involved in terms of where people came from. This is one of those that you can just see has a possibility of spreading out rather dramatically. The virus is still out there, there is no cure, and there is no vaccine. We can't throw caution to the wind now. If you go out in public for any reason, please wear a mask. This is CDC guidance, and it protects your family and community members. I wear my mask to protect you. You wear your mask to protect me. I did want to take a few minutes today. We haven't talked about this for, I think, at least a few weeks now, of how we are organizing the effort. And the governor and I always are giving you snippets of information, and hopefully that pieces together into a good, complete story. But this is what I wake up every day and think about. It's what I think about when I go to sleep at night. It's what our agency does. It's how we organize our effort. And we call it our COVID-19 lines of effort. I'm going to touch base briefly on each of these. Line of effort 1 is epidemiology and disease tracking. And again, these are ones we came up with in February, and they have withstood the test of time. We've talked a lot about the necessity for contact tracing and really understanding disease at its source. If you look at the map of Kansas that we have on our website, you'll see we have two kinds of counties. Counties that have very little disease, and then we have counties that have many, many cases. And that's why we accelerate our efforts in the cluster tracings and tracking. Line of effort number 2 is community testing and lab testing alternatives. We have had so many promises, and occasionally those promises come through with testing materials, testing platforms, swabs. We finally are in an enviable position now where we're sharing test kits, we're sharing swabs with hospitals, with local health departments, with care providers, with nursing homes, nursing facilities. Number 3, line of effort 3, media and community engagement, education and engagement. And thank you to the press for your diligence in reporting on this. And thank you, community members, for the most part, paying attention. As you can see from the Lake Perry event recently, there are some that are skirting the rules, and beyond that, skirting their own common sense. They know better, and yet they do it anyway. So our job within my agency, within the Kelly administration, media and community engagement and education. Number 4, isolation and quarantine management and enforcement. You know, fortunately, this has not been as big of an issue. Way back when, seems like forever ago now, when we had some Kansans that returned to their home state from a cruise ship that came into San Francisco. We helped them get off that cruise ship because, as you recall, it was not a cakewalk for those people that were stuck on that cruise ship. They're having a miserable time. We made sure we brought them home, but we also made sure that the isolation and quarantine management and enforcement was in place. Fortunately now, people have been motivated once they find out they're a contact or they themselves are ill. This has not been a big of an issue. People have been pretty diligent about this, as best we can tell. We don't have eyes and ears everywhere, of course. Number 5, line of effort number 5, policy and guidelines. We try to give the best guidance we can. We listen to many different sources from CDC and others so that we can help with not only what kind of actions were taken, especially as it relates to schools, as it relates to stay-at-home executive orders and the like, but also going forward, what is it that we can bring to the policy and guidelines that we get implemented into that affect each and every one of our lives. Line of effort number 6, community relations, school, local health department, and I probably should add nursing facility functions and entities. As time has unfolded, we've done more and more hotspotting and locating in certain areas. We only have probably about 4 or 5 counties now that are really significant problems. There's a few that could tilt either way depending on how people act over the next few weeks. But we only right now have 4 or 5 counties that are significant problems, and those are the ones that won't surprise you that are related to prisons, meatpacking, and nursing facilities. Line of effort 7, best practices research. This has been a struggle, and I will tell you, by what I mean by that is there's information now coming out all the time from China, from South Korea, Singapore, Italy, France, the United Kingdom, and of course our own country, especially New York, California, Seattle. And it's just a deluge of information, and I'd like to publicly say thank you to KHI. KHI has provided some people, Charlie Hunt is a good example of that, who have been scanning this information out there. And the reason is we're busy putting out a house fire within a house fire, and I don't want to let any of these learned lessons from other countries and other states slip through our fingers. So thank you very much for the volunteerism to be the eyes and ears not only of the KDHE but of the Kelly administration at large. And then finally, line of effort number 8, materials, supplies, and stockpile. We knew from very early on that the state stockpile we had was sufficient for a normal, and I think we are catching up to that now. The fact that we have our reprocessing of masks, because masks has been a hot button, has really helped so that now we're preparing for a rainy day called the fall and winter. So in summary, and this is the end of my formal comments, the lines of effort,
You're upset about it.
I'm not pleased that people show lousy judgment, and it does upset me. As a matter of fact, I was on the phone with my compatriot in this, Dr. Gianfranco Pizzino, the Shawnee County health officer, and he and I were both venting and blowing off steam with each other, but at the same time saying, okay, this is reality 101, let's get at it. We got work to do.
Can you clarify some things, though, because it's not based on what I've read in terms of, because I think you said 2 different things relative to when this happened. You said something about an incident earlier in the month, and then something about this has to be filled to make sure.
And good question, Jim. So the exact timing, I don't know the result of that investigation because it's still ongoing. And you're exactly right. Between May 2 and May 10 were the dates that were issued in the press release by the Shawnee County Health Department.
So that's when it happened. So.
Yes. Mm-hmm.
And you also said that it forced the closure of the police recruit academy.
Yes.
That's probably a pretty good clue as to who participated in this.
Well, I think in actuality that the recruit that was the index case from the academy was a contact person who became ill at that event. So they were kind of in that first ring out, found through contact tracing, who then became ill.
But you don't know anything about the characteristics of the group itself and who these people were? Was it a random social event or was it a cohort of some sort?
I don't know the answer to that yet. I know that the Shawnee County Health Department is getting more information as they do that contact investigation now, gatherings as well. So real concerned about it. But we're hoping that people will take it seriously. I do worry, to your earlier point, though, that it does befuddle me that people are so willing to take that kind of risk.
It would suggest, and this is just an anecdotal observation on my part, but we had to go out to Lowe's this weekend to grab some things, and just
this weekend a little bit doing some errands. I always had my mask on, of course, and because you just don't know. I mean, if you're out in wide open spaces and there's nobody there, and you obviously social distancing isn't an issue when you're out in the wide open spaces, the risk is extremely low. It's negligible. But you don't know in a I don't pick on any particular retail outlet, but you just don't know when you're going to be in close approximation with somebody. And I worry a lot too about things that you think you know, like I'm getting on this elevator, and there's nobody else on the elevator with me. Oops, there's one that jumped in at the last minute. Do you then pause, put on your mask? Should, What about if you get on an elevator and somebody just had been coughing and sneezing and they're gotten off and there's still fine particles in the air? Because I think we're getting a little bit of an inclination that maybe these particles hang in the air a little bit longer than what we'd originally thought. Again, back to line of effort 7, best practices research. There's indications out there that it's hanging around, especially in certain circumstances, if there's not a lot of air exchanges through your HVAC system or filtration and the like, it might hang up in the air for minutes.
I guess the bottom line, do you have any way as the state's chief health officer of knowing, generally speaking, how many people are observing the rules versus how many wouldn't? Because this could be a problem for you if it becomes widespread, so how do you track that?
Right. There are some applications that you can find where about how much general movement, but at this point in time, driving it down to one individual person is not easy to do. There are some applications that are being developed out there. It's widespread in the news that you can see about Google and Apple that are coming together that uses a Bluetooth-enabled phone app that people, it's thought that they will say that it's something people can download if they choose to know that will then ping them when they find out, because of the tracking that's inherent in that they've come in contact unknowingly to somebody who also has been on the same system and has become ill with the disease. But I don't have we don't have that access to that. The app doesn't even exist at this moment.
What underlies your concerns about Memorial Day weekend? Is it because of the incidents like what this Perry-like thing suggests is the public attitude now, that people are not taking it seriously enough?
Yeah, and yes, the question is why the Memorial Day weekend? People are going to be out and about more. They're going to be doing do-it-yourself projects. They're going to be going to the lumber yards and those kind of places. They're going to have family gatherings, multi-generational ages, all different ages. And so I think there are just going to be more people in close approximation with people.
Would you mind speaking more a little bit about the false sense of security that being outdoors? There might be a large group of people, but they say, well, we're on the outside, so we're fine.
Yeah, false sense of security. I think it really is. And you see people even doing good old-fashioned hugs and handshakes and, as much as we want that to come back, it should not come back. And that's close approximation even if you're outdoors. I think there is a measure of safety by being outdoors with nature's great air exchange. There's even some early suggestions, again, back to line of effort 7, that the sunlight and atmospheric conditions are unfavorable to the virus outside, which would be nice. And so I think it's mostly just increased activity, increased presence with each other. Martin?
Should we have been happy that we had a lot of wind last weekend?
Well, I think anything that keeps the air moving will make it more likely. It's essentially like an air exchange in a building. The more air exchanges you have, or the more laminar flow one direction and outside, the better off you are.
Secretary, regarding the distributed remdesivir, how is KDHE tracking the drug's effectiveness, and is it too early to say how effective it has been in Kansas?
Yes, good question about remdesivir, the emergency use authorized antiviral drug. We distributed 10 cases out on Thursday and another 25 cases, on Saturday. We used a formula, and it's very clear, and it's the right thing from the feds who pushed this drug to us. It's going to patients and not to hospitals. Or let me rephrase that. We're not pre-positioning in hospitals in case they get patients. It's sent out to places where there are active COVID-19 patients so that they can be evaluated for their suitability for the drug. So one, it's patient-focused, and second, we have a list of about 15 different data points so that we can know who's getting the drug, what are their clinical indications for the drug, beyond just being COVID-19 positive. How has the response been? Now, this, quite honestly, is not what we would consider to be high science or high quality research. It's not a double-blind randomized controlled trial where somebody's getting drugs, somebody else is getting placebo. But again, this is a novel time, and it's essentially a compassionate use. So we're pushing it out to people, and we'll follow to see how they do. Will we be a lot smarter a month from now or 2 months from now? I don't know if we will be or not, because we aren't comparing it to a group that gets placebo. But those studies are going on out there, and we will rely on those studies to guide us going further, because the FDA cares a lot about whether this one ever receives FDA approval. It's approved now just on an emergency use authorization.
So in other words,
Martin?
4 day.
I'm sorry, say it again?
Is that the 4 day?
It's 5 days. There's a variety.
Cuts your hospital time by.
Oh, yes. Okay. The question is that the drug that has perhaps been shown to decrease the length of hospital stay? Yes. I thought you were asking, but I'm going to say it anyway. The dosage schedule is 5 days, but it can be up to 10 days. But it's fascinating. There's some school of thought says, let's give it to somebody early on if they're at a high-risk group and they're in the hospital and they're a high-risk group for developing complications. Let's give that to them early on before they take a real nosedive. And there's others that say, no, this should be used for somebody as a salvage, essentially, in an intensive care unit on a ventilator with increasing oxygen requirements. I think because of the tens of thousands of cases of the drug out there, I think we'll get a glimmer of what really works and what doesn't, but we will depend ultimately on the research findings to guide us.
Well, relative to this use in Kansas, what you're saying is you have data points, so you're tracking how the patients who are administered the drug fare, but you can't attribute any improvement or lack thereof to the drug itself, because you don't have the right.
It'll be hard to come up with that definitive as if it were a research finding, absolutely.
One other quick thing, you mentioned, could you say, you said there are 4 or 5 counties that have a significant problem.
Right.
I mean, obviously Ford.
Yeah, Ford, and really, there's more than that have significant numbers, but some are tracking down better than others. Johnson County, has big numbers, but it's starting to trail down now. Wyandotte improving, Leavenworth stable to slightly improving, Ford and Finney problems, Seward a problem. So Lyon improving. Those are the counties that we've had on the most intensive watch list. And I think what we're going to find is that over this next, especially over the next 5 days, I think we'll get some real solid indicators. See, we're really only 10 days into this relax. From a data perspective, we're only about 10 days into this data analysis phase from the movement from 1 into 1 and then now 1.5 today. And the reason goes back to what I said earlier about, are you monitoring when people have symptom onset? Because that's when it reflects the disease activity, disease spread, as opposed to when you just count the cases, because that's nuanced by when that is sent into us. It's a little bit like a cash flow in a business. You know, every day, it's not like you get the same amount of cash flow into a business every day. Some days a bunch of money comes in the door and some days not so much so. So you have to follow it over quite a number of times. I think we'll feel, even in a few days, a whole lot more confident because we're going to be a good solid 10 days. And remember earlier discussions that, yes, it's a 14-day incubation period, but the lion's share start manifesting symptom between day 4 and day 7. So each one of these increments of time, I don't care if it's a week or 2 weeks, we get a lot smarter with every little additional data point.
So we shouldn't be alarmed by 454 new cases just since Friday.
No. Well, I mean, I'm alarmed that we have that many new cases, but we have that much disease out there, and we're getting better at testing. That's the bottom line with that one. The death thing is really important. 1 death since Friday. I've never said that to you for months. 1 death over a 2-day period of time.
How? Because it's only 1?
Yes. Yeah, that means we had 0 at one other day. And those days of 0 are few and far between. But that's reflected in both the hospitalization, which is below half of what it used to be, hospitalization per capita, death rates dropping nicely, less than half per capita what it used to be. Those are 2 very strong indicators right there.
You wouldn't expect it to stay at 1 or 0. You think there could still be peaks, right?
The day-to-day bouncing around in terms of the case numbers will occur based on the amount of testing and the timeliness of reporting. But when you look at the onset date, I think we're going to see continued improvement. Excuse me.
With the governor meeting President Trump on Wednesday, is there something you would want to speak to him about? You said you've had phones with the federal government before about getting supplies. What do you want to hear from him?
Well, that's a good question. He hasn't called me to talk about this, but if he did, what I think would be important to talk about is what do we need and the timeliness of what we need. I did have a nice, again, conversation with Senator Pat Roberts today. I know he just recently had a conversation with the president about what's going on in Southwest Kansas. And I think it's essentially give us our fair share and base it on a per capita, not on just raw numbers, because we're a small state, but doesn't mean on a per capita that we're out of the woods yet. Martin.
Are you okay on budget? Are you making it through the end of the fiscal year, or?
Well, are we okay on budget? We have spent a lot of money. There's no question about it. $53 million just on PPE alone. We've had a lot of personnel. We've had many National Guard soldiers and airmen that have been assisting us. They don't come for free. Somebody pays them. The contact tracers are volunteer. I think as we get better and better into the late spring and summer, I think the spirit of volunteerism will wane, and I think we will need to depend more on technology, as we talked about a minute ago with tracing, and also probably paid contact tracers. But when you're busy putting a house fire out, it's hard to bring on an army of what you need for contact tracing. So, long way of saying, Martin, I think that we are being vigilant in trying to spend wisely, and I hope that the money trickles down, because I know there's federal monies coming toward the state, and we've been okay for now.
You have no plot.
We haven't had to make a decision to not do something based on money
Last
yet.
question for me, you talk about, again, going back to the relative number of counties that have real problems. You have what?
Quote unquote expert.
Well,
No, just kidding. The per capita and death rates. And then it'll require some measure of trust, in a sense, of will people still continue to pay attention to these important principles that we've been talking about. So I still think there's a reason to not treat every county, for example, the same.
Are you worried about businesses skirting regulations or guidelines? An example is bars that don't normally sell food are selling food now to be open. Does that concern you?
Yeah, and it's been kind of a recurring theme with me, and I think you've probably heard it before. It isn't something we make a game out of. I can tell you those people that are ill from Lake Perry are not thinking that it's a game anymore to skirt around regulations. It's a bad idea. And it does bother me that people look at rules and say, okay, now how can I wiggle myself around them? Or just flaunt it and say, heck with it, I'm not going to pay attention to it. I'm going to do what I want to do. That's not a strategy for success.
One more question?
Are there good antibody tests for people that think they have it? You know,
Yes.
at Christmas?
Yeah, excellent question. And it's a question that I should address every week. And the reason is because the science is changing so much. Even as recently as a couple weeks ago, I would have answered that with no. The coronavirus antibody tests out there measure against all coronaviruses, including the one that causes the common cold. But now there are some emergency use authorizations for COVID-19 specific antibody tests, both an IgM and an IgG. Again, IgM is a marker that says it's a recent infection. IgG, to the question, did they have it 4 months ago? That would be more of an indicator of that. I think eventually what we're going to have is a very specific COVID-19 antibody, and paired with great questioning, and say to you, did you have any illnesses? Yeah, I got really sicker than heck back. I remember the second week of March. I was sicker than a dog, cough and fever, and now we measure your blood, and you've got an IgG antibody for a COVID-19 specific. You probably had it then, and it'll be terrifically enlightening to help us understand the movement and spread of this illness.